Good afternoon, ladies and gentlemen. My name is Khame Muangkroot. I'm the first-year medical student from Rangsit University. And today I am presenting a systematic review on the topic Enhancing Spine Surgery Accuracy, the Role of Robotics in Reducing Human Error. These are the table of contents. I wanted to start with the background of our study. We found that back pain is a common reason people consult a doctor to bring relief. However, some degenerative spine conditions may require spinal surgery, and we want to know whether or not robotic-assisted surgery will enhance the accuracy and reduce human error. And these are the conditions we found under research, as shown below. A surgical technique that are commonly used are called interbody fusion. It is used to treat and stabilize the spine by fusing two or more vertebrae together. And the most common conditions we found under research are anterior, posterior, and transforaminal lumbar interbody fusion. One of the most commonly used surgical tools in spine surgery are called pedicle screw because they are strong, have bony pillars that connect the front part of a vertebra to the back part, and it plays an important role in the reconstruction of spinal stability. The robots that are used in our research are called TINAVI robot and O-arm. The TINAVI robot is a surgical robot system designed to assist surgeons with spinal procedures, and the O-arm robot is a mobile imaging system that provides high-quality 3D images of the spine during surgery. And for hand surgery, we use fluoroscopy, which creates real-time moving images. Our objective is to evaluate the efficacy and safety of robotic-assisted technologies in spine surgery. The review aims to promote advancement and further studies on artificial intelligence in the medical field for improved patient care. Our studies include data on patients with orthopedic issues using robot to assist surgery to test the accuracy on placing pedicle screw placement, whether it improves or not. And after we found the records identified through Scopus in 86 papers, we removed before screening because it is not published from 2014 to 2024. It has no open access, and it is non-English language. After we screened records, we excluded secondary research and non-human study. And then we did a full text article assess for eligibility, which we excluded insufficient data, irrelevance, and incompatible data. In the end, we have in the total numbers of 12 papers included in this review, which have a total participants of 808 patients. This is our data extraction. You can scan the QR code to see the full data extraction above, and we have a baseline, study methods, and results. A system for classifying the accuracy of pedicle screw placement in spine surgery is separated into two systems. One is Gertzman-Robbins scale, or GRS, and number two is Rampersad scale. The GRS scale used to assess the distance of screw tip penetrates the pedicle cortex, which are graded A, B, C, D, and E. Grades A and B are clinically acceptable, and the Rampersad scale are used to assess the screw position relative to central axis of the pedicle, which graded 0, 1, 2, and 3. Grade 0 and 1 is clinically acceptable. The GRS are simpler and easier to use and widely used in the research. A scale for assessing pain level before and after treatment procedures are called Visual Analog Scale, or VAS. We use this to monitor treatment to see if interventions are working, which are scaled from 0 to 10. 0 is no pain at all, and 10 is the worst pain possible for the patients. These are our results from the research we did. We have a baseline and study methods. The results on GRS score, if you see on the pink column, it is a robot-assisted surgery, and the green column is freehand surgery, which you can see the numbers that for clinically acceptable, the robot-assisted have significantly benefit the patients more than the freehand. This is the Rampersad scale on both robotic assisted surgery and freehand surgery. On the left column, you can see it's RA surgery, and on the right columns are the FH surgery. And you can see on the second row that the RA score 88 to 98% of clinically acceptable, and the FH score 53 to 74% of clinically acceptable, which means that the robotic assisted benefit patients greatly. These are the results of the VAS score difference. In both groups, you can see there's no significantly difference, and the numbers are really low for the pain level for the patients. Additional findings for post-operative complication, we found that from 85 cases, robot-assisted group have 1 case of nerve injury. In freehand groups have 2 cases of screw loosening and 1 case of nerve injury. And we also found that the robot-assisted group have less amount of intraoperative blood loss, less patients' radiation exposure, and shorter average length of hospital stay. We can conclude that the robot-assisted benefit the patient greatly. From this, the strength of our study, 12 studies shows that using robot-assisted surgery have advantage over freehand technique, and the TINAV system is the most advantaged robotic system of all, which bring out optimal patient outcomes. Although there are still some limitations to our research, that we have insufficient report or follow-up period and operative time. We have difference in grading labels and patient conditions. With further research, we can minimize this limitation in the future. And I wanted to conclude that due to the technological advancement in medical world, this research aims to assure the accuracy and safety of the surgery by using robotic-assisted method and benefits the surgical field to advance towards evidence-based practice, improve patient safety, and greater efficiency in delivering high-quality surgical care. With further investigation to have better research in the future, we can adjust the statistic, define minimum follow-up period, and standardize grading label. This is our references. I want to thank you, Ms. Nishagantarat Raisin, for assisting me in this research, and I want to thank you all the judges for listening today. Thank you very much.
Such a concise explanation. Do you have any comments or any questions?
Thank you for your presentation. It's quite promising for the robot to help for the surgery. And I would like to know, normally, do we have the indications for the robot? I mean, the robot helping surgery in this case? I mean, from the study that you already include to your study.
So from all the studies we included, are all use robot versus freehand surgery.
Compared to freehand,
Compared
right?
to freehand, yeah.
And are there have the others, I mean, indications between these two methods? Or they are exchangeable between these two groups?
They have one control group of using robotic assisted and another control group of freehand surgery, which they both have similar condition as we shown in the slides before, in the beginning, in these conditions.
Do you try to apply meta-analysis to summarize the result?
So we do not have enough time, and I'm only beginning to do research, and I think this is the first way of doing research. So we did not consider doing meta-analysis, but in the further research, we would do meta-analysis for better analytic for this kind of research in the future.
Okay, but from your result that you present, I think you can apply the meta-analysis. It can make you more confident to conclude that the robotics are significantly better than the hand-free operation in terms of the accuracy and the side effect, something like that.
Okay, thank you for your kind food advice.
I wonder a little bit about your search term, because it seems like you combine every search term into with an and, right?
Yes.
Especially the word like accuracy. In some study, they might not use that word for. You may need to explore a little bit. Maybe some study did use the robotic compared to the freehand, but they did not use the word accuracy because maybe they are looking at other outcome. So you might need to explore a little bit about the search strategy. I'm not sure whether you did that or not when you do the searching.
We just wanted to know about the accuracy, if it really improves versus using freehand. So we put the word accuracy in the research, but we will consider that in further research.
I
I would like to know what kind of the electronic database that you use to select the publication
Do you mean all
and how many?
Do you mean for the data extraction?
Oh, no.
Or
Why did you use only Scopus?
oh.
Uh-huh.
So we found the most papers in Scopus, and we excluded to find the ones that are in our inclusion criteria. And there's only limited number of papers to this to using robot for orthopedic surgery.
In general, I think we should use more than one electronic database for searching the publication for prevent the publication bias from only one electronic database. Okay.
Okay, thank you.
Any more questions here? Thank you so much.